You know, Kyle Shanahan was my fraternity brother.
He was at the same time?
Yeah, no, he was, so he's.
There's a quorum present, all of our court members are present, all the legal notices have been posted, and the court is duly called. Now, we got 4 members down, 1 member up, and that is allowable under the current law. All right, is there a motion, and by up, I mean, we have 1 member that is joining us virtually from their office, and here in the building. And is there a motion to close court for the December term?
So moved.
All those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Is there a motion to open the January term?
Second.
All those in favor signify by saying aye.
Aye.
That motion also carries unanimously. Bailiff will please open court.
All rise. The Dallas County Commissioners Court is now in session for the January 2022 term. The Honorable Clay Lewis Jenkins presiding. Please remain standing for the invocation.
And our invocator today is a guest of Commissioner Price, who will join us online. Commissioner?
Judge, colleagues, we're very pleased this morning to have Pastor Branden D. Walker, who serves as the pastor of the Mount Tabor Baptist Church in Dallas. The reason this is real significant because Pastor Walker is the only 3rd pastor of the Mount Tabor Church since its founding. This church has a history. Mount Tabor's founder, the Reverend Floyd D. Harris, didn't merely build an edifice. He created in this community a church that understood what it needed to be able to bring forth God's future prophets. And so long before anyone ever thought about an 8 o'clock worship service, Pastor Harris was opening his pulpit to young minister students across the street at Bishop College. And so he sold and produced a few influential pastors and theologians. And thus out of Houston came from the Greater Tabernacle Baptist Church under the leadership of the late Dr. Donald Burgess Sr., a young pastor by the name of Branden D. Walker. Over the last 20 years, he's been afforded numerous opportunities to inspire thousands, both young and old, through the Word of God. For nearly 10 years, he served as the staff pastor of the Antioch Fellowship Church of Dallas, founded by the late Dr. Kerry D. Wesley and led by Pastor Christopher K. Wesley. His roles varied from pastoral care to youth. He's a young man and has, old black folks say, with an old soul. And he has the uncanny ability of communicating the word in a way that is relevant to younger generation and respected by seasoned generation. And today we're just glad to have with him. He, besides preaching, his greatest joy and biggest accomplishment is being married to his beautiful wife, Amber. His mantra is based on Paul in Acts 20:24. But my life is worth nothing to me unless I use it for finishing the work assigned to me by the Lord Jesus. The word of telling others the good news about the wonderful grace of God. And Pastor Walker, thank you for being with us this morning. Can we get it? Is he there? I see him.
Thank you so much for the invitation, and thank you for this wonderful opportunity. allow me to do what I've been asked to do. Let us share in prayer. O Lord, our Lord, how excellent is thy name in all the earth. This is the day that you have made, and we choose to rejoice and be glad in it. We are grateful for your compassions that fail not, and for your mercies that are new every morning. And we express the same sentiments of the prophet Jeremiah. Great is thy faithfulness. Thank you for being faithful to us, especially in those moments when we were so unfaithful to you. Father, we thank you for this day, for this time, and for this opportunity that you have afforded us to serve you by serving your people. Father, we realize that the best way that we express our love, appreciation, and faithfulness to you is what we do for others. So, Father, I pray now that you would give all of us a renewed will and a renewed heart to do what is best for those around us. As we make decisions and as we implement plans, may it be for the greater good of everyone, because that's what you would be pleased with. Furthermore, God, I pray that you would grant wisdom, that you would grant insight, clarity, and strength, that the best decisions can be made, and that all in all, your name will be glorified in everything that we say and do. Have your way. In the name of Jesus the Christ, we pray. Amen.
Amen.
Thank you, Pastor Walker.
Thank you.
Thank you.
Everyone can be seated.
And for
Commissioner
those
Price?
who are, he turned the mic off. And for those who are viewing, this is not George Wallace, segregation now, segregation forever. They just got me sitting down here. The first resolution is the South Oak Cliff 2021 Championship Resolution, which we presented to Dr. Hinojosa, and all it needs, Judge, is the ratification, and I so move.
Second.
All those in favor signify by saying aye.
Aye.
Motion carries unanimously. Next, we need to ratify 2 Employee of the Year resolutions from this previous court session. I move Employee of the Year resolution for County Operations, Rachel Rueda from HSEM. All in favor?
No, a second, Judge. You moved it. I thought we
I'm
just
sorry,
ratified.
second. Yeah, is there a second?
Yes, second.
All those in favor signify by saying aye.
Aye.
The motion carries unanimously. I move the Employee of the Year resolution for Constituent Services, Alejandro Rodeo, from the District Clerk. Is there a second?
Second.
All those in favor signify by saying aye.
Aye.
Motion carries unanimously. Commissioner Garcia has the next resolutions this morning.
Thank you, Judge. Colleagues, good morning. Today, we're going to present a resolution for Human Trafficking Prevention Month. We are joined virtually by Bianca Davies, CEO of New Friends, New Life, which will be speaking and receiving the resolution on behalf of her board, Tracy Nash Huntley, board chair, Annette Bailey, survivor and economic empowerment specialist, Jessica Brazil, chief program officer, Hannah Counter, Youth Resource Center program director, and Priya Murphy, senior director of development. Also, we will hear, and also accepting the resolution, Kimberly Duran, program clinician with Dallas County District Attorney's Office, will be speaking on behalf of the New Life Opportunity Board, which I chair, with Stephanie Valdez, treasurer of the board and community member, Sergeant Reginald Luster, Dallas Police Department Vice Unit, Capitan Rufin Salas, Dallas County Sheriff Department, and Lisa Cross, Parkland Health and Human Hospital System. Also, working with us, Mr. Thomas Perkins with the City of Dallas Community Court Prosecution, but he won't be able to attend. So, the resolution reads as follows. January is Human Trafficking Prevention Month. Every year on January 11, Human Trafficking Awareness Day is observed. Human trafficking is a form of modern-day slavery in which traffickers target vulnerable populations, including men, women, children, citizens and non-citizens, forcing them into a servitude and or the sex trade. And whereas victims of human trafficking suffer severe emotional, psychological, and physical terrors at the hands of their captors, who instill fear to keep them enslaved. Traffickers typically use multiple means to control their victims, including beating, rape, isolation, drug, and or alcohol dependency, document withholding, and psychological and emotional abuse. And whereas Texas ranks second in the country for trafficking prevalence, with more than 300,000 annual victims statewide, and in Dallas, an estimated 400 teens are sold for sex every night, as part of a 99 million illegal industry. Sex trafficking is the #1 fastest growing organized crime business in the world and the 3rd largest criminal operation. And whereas, in an effort to create awareness and become proactive in eliminating human sex trafficking in Dallas County, different organizations and programs have created systems in which victims of this epidemic can help, as well as offenders can be educated and effectively prosecuted. Whereas New Friends, New Life is one of the programs in Dallas County that restores and empowers formerly trafficked teen girls and sexually exploited women and their children by providing access to education, job training, interim financial assistance, mental health, and spiritual support. New Friends, New Life helps women and their children overcome backgrounds of abuse, addiction, poverty, and limited opportunities. And whereas other local organizations that focus on combating this devastating epidemic are as follows: New Life Opportunities, Health Options for Personal Empowerment, Class Solicitors, Traffickers and Offenders Prostitution Stop Program, Pretrial Intervention Program, Dallas County District Attorney's Office, Dallas County Sheriff Department, Dallas County Public Defender's Office, Dallas County Star Court, Dallas County Health and Human Services, Dallas Police Department and their Vice Unit, City of Dallas Community Court Prosecution Diversion Initiative, Mosaic Family Services, Heaven of Love, Is Going to Be Okay, Parkland Health and Hospital System, and 24 Hours Dallas, among some. So therefore, now be resolved that the Dallas County Commissioners Court does hereby declare the month of January as Human Trafficking Prevention Month and January 11 as Human Trafficking Awareness Days, commends New Friends, New Life, and the local organizations for their advocacy and commitment to help victims and their efforts to eradicate human trafficking in Dallas County, and I so move.
Second.
All those in favor signify by saying aye.
Aye.
Opposed? Motion carries unanimously.
And I know that we have Ms. Bianca Davis, CEO of New Friends, New Life, in the queue and registered to speak. Ms. Davis, can you see us? Is she in the queue?
Yes, can you see and hear me? Good morning.
Good morning, Ms. Davis. Good to see you.
Good morning. It's so great to be here. Good morning, Judge Jenkins, Dr. Garcia, and the commissioners of the court. It is my honor to join you on behalf of New Friends, New Life, our esteemed board of directors, our dedicated staff, many of whom are watching live, and the women and girls that we serve. I wanted to say that I'm so proud of the effort, attention, and resources that the leaders and residents of Dallas give to combat the issue of human trafficking, not only during the month of January, but all year long. New Friends, New Life is a firmly rooted piece of the puzzle in this city's concerted effort to support survivors and hold perpetrators accountable. I once heard someone say that for most survivors of human trafficking, this isn't the first bad thing that has happened to them. And indeed, we know that this is true. Of the nearly 200 women we served last year at New Friends, New Life, 72% had experienced childhood sexual abuse, 70% already had a criminal record, 60% had been diagnosed with a health condition, and 30% were living in shelters, transitional housing, or on the street. So being sold for sex is another horrible thing on the list of horrible things that have happened in their lifetime. Because the problem is systemic, the solution must be collaborative. We partner with the groups and agencies that Dr. Garcia listed in the resolution and many others as a part of a 360-degree approach to prevention, mitigation, and restoration. We know that it really takes a village, and I want to applaud every agency and entity for the role that they play in this fight. I also hope that Dallas County knows that your work and your effort are not in vain and that we are making a difference. Last year, we debuted our inaugural class of the Alumni Circle, consisting of women who've graduated from our 4-phase program who wanted to stay close to the agency. A couple of them have written books, one closed on her first home, 2 are survivor leaders who work with New Friends New Life, and they're all thriving. Our goal is to continue growing our alumni circle, which is the clearest evidence of the transformative change that is possible when we all come together to take a stand. The final 2 things I want to add is, first, today, January 11th, is also the 2nd anniversary of the governor's pardon that one of our survivors received. It is a phone call and a process that absolutely changed her life, and we are grateful that she's living in the freedom that she deserves. So happy pardon anniversary to Robbie. Secondly, and lastly, for everyone watching remotely, this is also National Wear Blue Day. So you still have time to wear something blue, take a picture, post it on social media with 2 hashtags. First is Wear Blue Day, hashtag Wear Blue Day, which is deemed so by the Department of Homeland Security. And the second hashtag is Stand for Her, the New Friends New Life hashtag. So thank you, Dr. Garcia, to the commissioners of the court for your acknowledgement and support of our collective effort to eradicate human trafficking in Dallas, one survivor at a time.
Thank you so much, Ms. Davis. We couldn't do it without your leadership and the New Friends New Life dedication to do this.
Thank you.
Thank you
Thank
so
you
much.
so much.
And say congratulations to Robin. She deserves it. Thank
Yes,
you.
we will.
To the board and everyone that is virtually joining us, thank you so much for your leadership as well. And now the second speaker is Ms. Kimberly Duran, Program Clinician with Dallas County District Attorney's Office and member of New Life Opportunities. Ms. Duran, thank you so much for joining us today.
Good morning. Thank you so much for the invitation to briefly speak. Good morning, commissioners. Good morning. I will be a little bit more brief. I just want to thank all of the community providers on behalf of the New Life Opportunities Board for those agencies in the community, those individuals in the community that work with this population. As we all know, it's a very difficult population to work with. And so we appreciate and we just give a lot of gratitude to those agencies like New Life Opportunities or New Friends New Life that go out, work with these individuals, especially the individuals boots on the ground. We work with several agencies that actually are out there on the streets and just helping these victims. So we really, really appreciate them. We couldn't do it without them. I also just want to commend the state of Texas for increasing the accountability on the demand side. We can't fight this battle, helping the victims and helping pull the victims out of this lifestyle and stopping that trajectory for them and the cycle of this without cracking down a little on the demand side. So I do really appreciate the state of Texas for increasing their accountability. So on behalf of the New Life Opportunities Board, I just thank you for your support and thank you to all the community members.
Thank you so much, Ms. Duran. We appreciate you and the program, and the Dallas County District Attorney's Office for all the work you do. We couldn't do it, without you, and you are the leader when it comes to stop classes in Dallas County, and we appreciate you being with us this morning. And of course, last but not least, I want to recognize Ms. Blanca Torres, Deputy Chief of Staff for Road and Bridge 4, for always being, the amalgamator between all these groups so we can continue to work together. So, muchísimas gracias a todos. And don't forget, wear blue and the hashtag Wear Blue Day today. And hope to see you in social media. Thank you, Ms. Duran. Thank you to everyone.
Thank you.
Dr.
I just wanted to say quickly, too, that I want to add my voice to, first of all, the thanks to New Life, to Ms. Davis, Ms. Duran, and Commissioner Garcia for highlighting what is a very serious issue in the Dallas County greater area. And thank you for the efforts in making life, giving hope and providing some kind of an outlet for assistance for people who have been dragged into the awful life of trafficking. So thank you for what you have done yesterday, thank you for today, and for what you're going to do in the future.
I'd like to echo that. Thank you for bringing this forward, Dr. Garcia. You know, New Friends New Life does an incredible job lifting up survivors and helping those victims work through what is essentially torture. I also want to thank the city of Dallas. They're taking very significant steps to limit sexually oriented businesses. They have been one of the hotbeds of traffickers and enablers, and those strip clubs need to be cracked down on. So I'm glad that, and then Ms. Duran mentioned it, that, you know, it's two sides of this thing. We're absolutely, you know, got to continue to do well lifting up those victims, but the state's given us greater tools to crack down on demand and really, you know, really start taking it to Johns and pimps, and it's time to start seeing those folks show up in our jails because they deserve it.
Thank you, Commissioner Koch, I appreciate it. And thank you all for that join us virtually. Our job continues during this pandemic, so thank you all. I hope to see you in person soon. The next resolution is also mine, and is a resolution that is going to be presented at a later date to Irving Police Chief Jeff Spivey due to his retirement. I am going to put it in the record since it will be given at a later date. And it reads as follows. Whereas Dallas County takes a special notice when a citizen has contributed valuable time, knowledge, and experience to its community and residents. And whereas Chief Jeff Spivey is a 35-year veteran who joined the Irving Police Department in 1988. There, he worked his way through the ranks, serving on supervising in all areas of the department, from a police officer to patrol and crime investigation. And whereas Chief Spivey holds a master's degree in criminal justice leadership and management from Sam Houston State University, he is a graduate of the FBI National Academy, PERF Senior Management Institute for Police, and the Bill Blockwood Law Enforcement Management Institute of Texas Leadership Command. And whereas in March 2017, he was appointed Chief of Police during his tenure, he promoted a culture of procedural justice throughout the organization and has worked arduously to strengthen police relationships with Irving diverse communities. Additionally, Chief Spivey led a departmental reorganization, increased personnel by 20%, enhanced community outreach through the national recognized Shop Talk program, implemented peer support services, formed a mental health response unit by fulfilling a pledge to the One Mind campaign launched by his International Associations of Chiefs of Police to improve how it responds to people with mental illness. And whereas Chief Spivey chairs the Carruth Police Institute Executive Advisory Board and serves on the Board of Directors for the Police Executive Research Forum and the Executive Committee for the International Association of Chiefs of Police Mid-Size Agencies Division. He also co-chairs Pathways to Hope Advisory Board, a reentry diversion program through One Community USA, and is a board member of Brighter Tomorrows, an organization that empowers survivors of domestic violence. And whereas last November, Chief Spivey announced he is retiring from the department to become the new executive director for the Carruth Police Institute at UNT Dallas. His new job will deal largely with formulating new ways to focus and treat mental health in police officers. Now, therefore, be resolved that the Dallas County Commissioners Court does hereby recognizes and congratulates Chief Jeff Spivey after 35 years of dedicated and outstanding service to the Irving Police Department, the residents of the city of Irving, and Dallas County. And I so move.
Second.
All those in favor signify by saying aye.
Aye.
Great job, Chief Spivey. Motion carries unanimously.
Thank you.
Next, we have presentations. Before we get to those, let me take a moment of personal privilege. One on a light note to congratulate all of our Georgia graduate employees, including Jason Romaine, who is very sleep deprived and happy this morning. The other, on a more serious note, about 20 minutes ago, I received the medical model from UT Southwestern. It doubles the number of hospitalizations that were projected only 4 days ago. We have already reached the number that they projected today for the end of the month. The new model projects, and I've shot the slides over to Phil, and we'll try to get through them if we can get them up on the screen quickly. The new model projects it will be above 2,000 just in Dallas County and above 2,700 in Tarrant County by the end of the month. It projects it will have about 10,000 positive cases a day in Dallas County on our drive-through test, not including all these home tests that people take. You know, that's one of the reasons why you see the courtroom different today. According to the doctors, this strain of Omicron is more contagious than any other virus, including the bubonic plague, not as deadly, but more contagious, that we've ever seen. So if you get in a close quarter indoors with a person that has COVID, you're very likely to get COVID. So for that reason, we're kind of zooming through things today.
Well, Judge, one of the concerns I continue to have is that while I see all this franticness and rush to get tested, I'm not seeing the same energy and effort with vaccinations. You know, and at the end of the day, you know, I don't think, I mean, all the hoopla is about testing. And when, and I want to thank Friendship West Baptist Church, this week they understood enough and they were inundated, I think, Sunday with testing. I mean, where are we with testing? You can take the dadgum, vaccination. You can take the test today and be negative, depending on your viral load, and then tomorrow you're positive. Where are we with vaccinations? I mean, that's got to be, and I had people all weekend because I think Friendship West was inundated looking for vaccinations. I think y'all had some, I think at Fair Park, but when are we going to talk about more vaccinations? I'm not even.
Sure. So we can have Dr. Wong update that. My office is doing 3, along with Dallas County Health and Human Services, doing 3 clinics this week. And Dr. Wong may know those addresses. There is, for those of you who are engaged, I know sometimes you come out to our clinics. For those of you who are engaged, we're moving people around a little bit this week because some folks are out. So Jason Romaine will not be doing the clinics this week. That'll be Eugenia Castaneda. Jason will go in and spell the Chief of Staff for Health and Human Services this week. And as people are moving around to cover others, we'll try to get an email out to the court as to who is in charge of what.
But I don't want us to miss. My staff is doing the same thing. And I called Dr. Wong, I think it was Saturday, about pediatric vaccinations, and they were able to make that shift over at Mount Carmel, which has been an ongoing site. We got these little pop-up sites. I'm talking about some massive, other than Fair Park, massive vaccination site.
Well, here's our challenge. And that may change, but what at least where we've been in our talks with CVS, Walgreens, Kroger, et cetera, they've got ample vaccine. They don't have ample tests, but they have ample vaccine. And they can make you an appointment by going to vaccine.org at many locations throughout the Metroplex, throughout North, South, East, West Dallas to get a vaccine. One of the challenges that we have, and it's a story for the press if they want to push it, is although over 70% of our people have had at least one shot that are eligible, of course a 4-year-old can't get a shot, but that are eligible, only a little over 15% of our people have been boosted. And that's why we're seeing so many of these breakthrough cases in people whose last shot was, say, in April or March. And now it's, been 10 months since their shot and they hadn't gotten their booster. So that capacity's out there. It's sadly out there. Commissioner Price would be right that we wouldn't have the capacity if people would get in there and get the shots that are due to them. But because so few people are getting shots, Phil, we're still at about 12,000 a week that are getting shots, right?
Right. Our latest numbers are 12,000 a week.
Yeah, so 12,000, to put that in perspective.
Of first doses,
When, 12, of first doses, okay. And then what about boosters and
Again, it's about a 1.5%, I think, increase per week in boosters.
So just to put that in perspective, back when we needed those mega sites and people were anxious to get shots, we did 12,000 a day at just Fair Park. Now the county with all the sites doing 12,000 a week, and we're advertising, we're basically begging you, go get your shot, go get your booster.
But we got people sitting in testing lines for 5 and 6 hours. This makes no sense. I'm just talking about making the availability. And I hear you guys continue to talk about, in this court has made a commitment in this community to talk about broadband and access and all. I hate to tell you, there's still a large segment of the population who are still not going to register online, who are not there.
You're right.
And so as a result, I needed to talk about massive vaccination sites like the Fair Park, like Parkland had at Ellis Davis, so that people can just come. I hear you say make appointments. People are going to do what people are going to do in terms of appearing, but I don't want any obstruction. Talk about, well, you need to go online, and I appreciate your partners and Walgreens and all of that. I'm just not seeing it in my community. I'm not seeing it. And so I really want to try to create, those sites that says, hey, vaccinations are here, and you don't have to wait 6 hours. You don't have to wait 5 hours.
We could look at a tent at Fair Park and Ellis Davis. I'm afraid we're going to be disappointed, sadly, with how few people go, but it's kind of like the Bible says, when 3 or more are gathered in my name, if we get anybody. So that's something that we can look at perhaps on the backside. We don't want to get them in with that testing debacle at which we're fixing at Ellis Davis, but we'll see about if we can get some mobile on that from AMR or somebody.
Well, I just want us to assist those people. Like I said, I think Friendship West had 300 or 400 people Sunday. Bam. Yeah. I mean, they blew through them. And again, the little Mount Carmels and all, I think Daphne told me, they had, I don't know how many pediatrics, how many adults, and they blew through them. But, those onesie twosies don't get it. If we can have 700 to 800 people come through a testing site and sit forever, we want, they can come and get the vaccinations. I still want to make it available. And right now, we don't have that availability in any mass other than Fair Park, and y'all are there just so on Sundays and
What are we doing as far as community education on this? Because it sounds as if, a piece of it is continuing to get the word out there. And I see that Dr. Wong has moved over. Can you address that part of addressing the vaccination part of COVID?
And you have a presentation, Dr. Huang. Do you want to start with it?
Sure,
so
sure.
you can address all the questions as you go?
No, I think we totally agree that vaccinations and boosters, in particular with Omicron, are some of the key strategies. We have not let up on that. The demand has decreased and sort of waxed and waned a little as the pandemic has progressed. But we have, the site at Eastfield that we've had 6 days a week, and we're actually going to be starting also offering that on Sunday, having the team that's been out at Fair Park on Sundays moving over to Eastfield on Sundays, and then since we're going to be offering testing, we're starting at testing at 6 days a week at Fair Park, then adding vaccination also at Fair Park, and so that should be, I think, 6 or 7 days at Fair Park. It may be 6 days a week at Fair Park. But we are absolutely, we're offering all the vaccination to all of our vaccination sites, our immunization clinics, and with multiple pop-ups, I know with some of your staff and others, and have had great partnerships on some of those with the churches, with Walmarts, other settings, and we totally agree with you that vaccinations and boosters are some of the key still, and I think every messaging that we've ever done, we make that, emphasize that. I know on social media and with our media campaign are still heavily promoting the vaccination and have not let up on that, because that is the key. The testing is one tool to help try to slow this down, but absolutely agree that the vaccinations and boosters are key for our future success, and we have not let down on any of our efforts. Some of the, as the judge mentioned, the actual demand has gone down. We're at about 12,000 first doses per week. At one point we got down to 8,000 per week, or 8,500. It's gone back up a little more since the Omicron and the public sort of awareness and concern about, renewed concern. Again, there's a lot of COVID fatigue. But we absolutely agree with you that everything we can do to continue to promote vaccinations is one of the keys to the success. And again, partnering with the drugstores, the grocery stores, other chains that have continued to offer that. As the judge mentioned, availability of vaccination has not been a problem. We have abundant vaccine, and I also always try to emphasize that in the messaging. The testing is very demanding. There's a high demand for that now. The vaccination, we've got abundant vaccine. Anyone who wants to get a vaccine can get the vaccine.
Yeah, but it's about us taking and managing, like I said, location. You say Eastfield. I mean, while it's in my district, it's 15 miles east of here. I'm talking about that whole southern sector. And again, we saw that Sunday, with Friendship. Well, we've seen it with Mount Rose. We've seen it with a few of those pop-up, venues of 300 or 400 people. But I'm talking about in some mass kind of a way. And I think they ran out on Sunday over there, and they were doing boosters and shots. And that's all they were doing. They did testing 1 or 2 days, but then they made it clear that they were going to be doing boosters and shots, and they were slammed. And we don't have anything else, nothing else in that southern sector. That's all I keep saying, ladies and gentlemen.
And we are definitely working with some of the other vendors that are running some of the current testing sites and working with them to add vaccinations. That's what we're trying to set up with the Ellis Davis. Again, trying to work on Fair Park, increasing that. And
I hope they do better with vaccination that they've been doing with testing.
Well, it won't be the same people doing vaccination.
Yeah. Well, that's a whole nother story, because I've been out there every day since they stood up, Judge, and including Sunday. I was out there every day, and I'm not pleased. So I'm looking for vaccinations.
And on the testing, I think at some point, maybe in our presentation,
we'll get a chance to talk about it.
We're going to have Nomi here. We had a meeting with them last night and received several assurances from them that we'll hear in public.
Sure. Well, I'll go ahead and go through some of the updates. Let's see, is this working? Or you want to advance it? Okay. So we are still in the red risk level. The availability of ICU beds, as you can see, has remained low, and this affects not only COVID, but also reflects other non-COVID conditions that are putting stresses on our hospital system. The number of ED visits, got it. In the prior 24 hours, you can see those numbers have now reached the highest levels that we've ever had since the start of this pandemic. Next slide. Confirmed admissions in the prior 24 hours. Again, those are reaching levels, the highest levels that we've seen throughout the entire pandemic. Next slide. The actual confirmed inpatients is approaching some of the highest levels that we've seen. And next slide. And then the deaths, a trailing indicator. Fortunately, the deaths have not yet shown that increase, but it is a trailing indicator, and we'll see how that progresses as the situation continues. Next slide. Last week we had two of our highest single-day records in terms of number of new cases reported in a single day. It was like about 3,500. We're averaging about, with the 7-day trailing average, about 2,185 new cases reported today. Next slide. If you look at the vaccinations, again, about the percentage of the population 5+ vaccinated with at least one dose is 71%. Next slide. You can see again the trend in the number of vaccinations administered, and this is for Dallas County per week. So, I mentioned about 12,000 first doses per week. It's about total 49,000 for all doses per week. But you can see, we really hit the peak back in April of last year, and since that time, just the demand has not ever gotten to that same level, although we certainly welcome and are trying to encourage vaccinations and boosters, as you also suggest, because it is one of the keys to us, to our being able to manage this. Next slide. Again, a little more detail on persons vaccinated with at least one dose, about 1.7 million in Dallas County, 1.489 fully vaccinated, and then about 448,000 with the booster doses.
Dr. Wong, hold up. And again, we say that one dose like it's, it's the miracle. The difference between people with one dose and people fully vaccinated is almost 300,000. And of course, people with the booster, like you said, is only about 448,000. At what point in time, and maybe you need to explain this, to the public. I mean, what does one dose do? We keep saying that like it's the Holy Grail. We got 1,700,000, got one dose. How long does that last? Otherwise, you wouldn't need a second one, and you definitely wouldn't need a booster. I mean, how long does one dose last?
Well, again, and we've, seen and learning more over time, and certainly then the importance and the data that showed the waning protection from the vaccine, has shown the importance of the boosters. We've always said to get the full protection, initially it required the 2 doses for the 2-dose mRNA vaccines. The 1-dose Johnson & Johnson, was initially out as a 1-dose, but again, we fully support and recommend people to get the full course, the 2 doses initially, and then the boosters after they're eligible, 5 months now after completion of the 2nd dose in the course. And we encourage everyone who's eligible for that to get those boosters as soon as possible. We don't argue with you at all. Again, we agree.
And a place where everyone could help us is encouraging people. I've heard from a man last week who was about my age and morbidly obese, and so that's a high risk factor for COVID. And he said, I got my first shot and I didn't like the way it made me feel. It made me sweat. I stayed up at night. I think the cure is worse than the disease. I don't want any of those other shots. And I talked to him, and another friend of his talked to him about the importance of getting his 2nd shot. even though this guy had gotten his first shot maybe over 6 months ago. And so there are those people out there that when they get that first shot, they're like, you know, that swelled up my arm, that made me have a fever, I don't want another shot. We got to encourage people, the cure is not worse than the disease. Get that second shot, get that booster. I think when the first dose numbers started being tracked by the state's theory was, well, once we get you to get your first dose, surely the vast majority of you will come back to get your second. Of course, they didn't know boosters even existed then. But what we're actually finding across the state is that those numbers are lagging about like we're talking about in Dallas County. There are just people out there who get the one shot and didn't like the experience, the way it made their arm or their body feel, and don't come back. And so we gotta, as we go out and speak to people, we gotta make that a point. Get your second shot and get boosted.
We also, and I discussed this with Dr. Huang as well, Judge, and I believe that one of the city managers sent you a letter, Dr. Huang, mentioning that, well, we're doing as much as we can with the vaccination, with the COVID testing, but we also need to start looking into different ways of managing COVID-19. And I believe, Commissioner Koch, you have mentioned it before, monoclonal therapies are already offered in other states. If you're sick, they're out of the hospital therapies that I believe are working. I know, Dr. Huang, that you have been discussing these with several entities, and as always, the big issue is amount of these therapies to be distributed. I know they're in short, high demand and short availability, but we need to, and I agree with my colleagues and with you, Judge, I mean, we're doing as much as we can do more, and I think the next step is look into therapies for out-of-the-hospital cases. And that is already, these treatments have already been approved. They're already in the website of the Health and Human Services federal website. So I would really like for you, Josh, and Dr. Huang to start looking into the availability of these treatments here in Dallas County, to have a different approach also to management, because what I agree with the judge in one part. I mean, some people were never going to convince that this vaccine will help us beat this virus.
But monoclonal, I mean, see, you know, again, maybe I'm getting mixed signals. You don't just give monoclonal.
No, I agree, Commissioner.
Okay.
But
So,
I mean, right now, we're doing the same thing that we've been doing, you know, with a short quantity, low availability, you know, but we're swimming in the same direction. Well, what else is out there that we can do to start fighting these on different fronts? I mean, I think Commissioner Daniels, and we have done marketing, we have done influencing, we have done everything that has been in our power. Has it been enough? I don't know. Can we do more? Yes, we can. You know, but what else we're going to do differently to beat this disease? I mean, if those numbers of vaccination do not continue to increase, we're going to have another variant faster than you can say hello. And we're going to be doing this all over again.
But
let's
the
stop it in the track and let's start fighting on different fronts. That's my point.
The messaging, yeah, I don't think that, and maybe it's clear to you guys, the messaging is not clear to me. I thought with monoclonal, you would have to almost have the onset and then get treated, and again, the supply demand. The vaccinations don't require that. You know, and so I get that, Dr. Garcia, and so it's the message. And everybody says, well, you know, when you get monoclonal, well, you got to first of all have the virus. It's my understanding, and then be on the early stages, early onset to get that. Vaccinations, you don't.
Right, vaccinations are much better than, you know.
And cost-wise, the cost, you know, we talk about supply and demand, and I'm just talking to people who are administering this stuff. You know, the cost, you know, it's.
If you get monoclonal antibodies, you're going to be out your maximum your out-of-pocket expense just on those. And there were 3 monoclonal antibodies that worked against Delta. There's only 1 that works against Omicron. So we're having a hard time keeping up with that.
Regenerate. I know.
So that's another thought. And Commissioner Price brings up a point that, for people to keep in mind, and this is true in Dallas County with our employees, or DISD, or AT&T, or whatever. If you end up being hospitalized with COVID, just like if you end up being hospitalized with a broken leg, we all know how this works. We have insurance, and that's great, but you get a bill, and that bill's pretty high. Your deductible might be $2,500 at your insurance. It might be more. It may be that you pay 20% of the cost of your hospitalization. So what do we know about vaccines and boosters? We know that vaccinated, boosted people are 20 times less likely to be hospitalized with COVID than people who are not vaccinated. So if you care about your pocketbook, that's another thing to really think about. This brand, or this strain rather, of virus is going to, if somebody walks into a room and they're not even going to know that they have COVID, and because not everybody's going to be like this commissioner's court where we all took a test before we walked in here. But if somebody goes into a room and they're around 8 other people for 15 or 20 minutes, they're going to walk out of that room with 8 people who have the Omicron virus. And then those 8 people are going to walk into a room, and so on and so on. In the UT Southwestern model, and we may put it up in a minute and try to go through it. I realize you and I hadn't really even hardly seen it, Phil. But you're talking about 1 to 31, right? If I get it, I'm going to pass it on to 31 people. And to put that into perspective with Delta and all these other ones, there's like 1 to 2, 1 to 3. But this is just a really explosive, epidemic. And another important thing to remember is it's not that the concern is we're filling up the COVID ward at Parkland or UT Southwestern or some other place. I might go to the hospital for a cancer treatment, a broken bone, a heart attack, and there's no room for me there. One of my staff was telling me a story yesterday of a friend's father who went to the emergency room and was tested positive for COVID 2 days ago, and yesterday, 24 hours later, was waiting to see a doctor. It's our doctors are sick, our nurses are sick, the emergency rooms are flooded. And it's not just about treating COVID, it's about treating anything. So if your aunt has cancer and she may have to go to the hospital, you may want to go get vaccinated so you can do your part to keep the spread down, so your aunt hopefully has a bed when she needs it.
And I just want to support what you're saying. As we've talked about, we really are advocating to use all of the tools that are now available, and we're not where we were a year ago. We do have vaccines, we've got the boosters, but also don't forget about the free thing, or, masking is another really important one of the tools and layers of protection that we have to make sure everyone's doing that. That doesn't cost that much. But then also the testing now is a new tool to use to try to do things safely and plan events. But then the monoclonal antibodies and the treatments are another tool that's out there. But, the state has had 5 regional infusion centers in the state, but they, ran out of the Sotrovimab, I think at the end of December, and which is the only one that's effective against the Omicron variant. And they are, I know, putting on their website some of the availability of some of the other medications, the new oral medications that are out there, but they're in very limited supply. So that's why it's still not, we want to take advantage of it as much as possible. I know the local county medical society, Dallas County Medical Society, was looking at how educating the physicians and how to best use this limited treatment that we have available. But right now, that's still very limited in availability, but it is absolutely another tool that we have to try to address this, and we want to promote and use all the tools that we have. But don't forget about some of the other things that aren't so technologic, just wearing a mask, physical distancing, avoiding crowds, outside better than inside. Those are other messages. that we want to continue to reinforce to try to slow this down.
Dr. Wong, could you talk a minute about the community education and what forms of media we're using to continue to alert and to inform the community about COVID?
Sure. Well, you know, we're working with ABI to continue to get messages out. We're doing social media. I know that our PIO has been doing, personal interviews with people at some of our vaccination sites to get those personal stories out there on social media, other social media avenues. And again, ABI has been, I think, doing a good job getting some messages out, and we're trying to refresh those messages and, try to keep the interest up about these issues that, again, people are getting tired of COVID fatigue is out there, but we're trying to continue to reinforce the importance of all of these.
Could you provide an updated report on what kind of contact and then what kind of response the media attempts are reaching?
Sure. And I think in our weekly vaccination sort of planning reports, we do update some of the latest figures, number of impressions and things, but we can definitely get you more information on that.
Thank you very much.
On this next slide that, points out what Judge Jenkins was talking about also, just the, that's the thing with the vaccinations and boosters available, much of this is preventable. Again, what we've learned is the vaccines are, extremely safe and effective against preventing severe illness, hospitalizations, and death. What we have also learned with the Omicron variant, though you can still test positive and get the infection and spread it to others, but have less severe illness, but that is important. But the hospitalizations and the deaths, again, are almost, just almost all are unvaccinated persons. Specifically, just some updated information regarding Omicron from CDC. As we've said, it's just the numbers are exponentially increasing across other countries in the United States. Mostly likely due to a combination of two factors: increased transmissibility and the ability of the variant to evade immunity conferred by past infection or vaccination. But they're still determining what's the precise contribution of each of those factors. And so, again, CDC also is looking at modeling scenarios suggesting that current increases in Omicron cases, again, likely to lead to this national surge in the upcoming weeks, with peak numbers of new infections that could exceed previous peaks, is what we're already seeing. 2 weeks ago, I think some of our modeling teams were suggesting, or maybe last week, suggesting probably in 2 weeks we might see our peak, but we'll see how those numbers play out. And it still also is dependent on how we all as a community respond. Next slide. This shows just the proportion of the variants that have been seen in the United States. And so the orange bars are, from like November or October to present. And you can see the Delta variant was the predominant strain. Almost all of the strains were Delta. But how quickly the purple variant, which is the Omicron, came upon us. It started, the first was December 4th. And, in just a matter of 3 weeks, the Omicron variant became the dominant strain that was circulating in our community as well as in the United States. Again, that 3-week takeover of the strains, comparing to that with Delta, it took about 3 months for the Delta strain to become the dominant strain. So again, shows just how rapidly spread Omicron is. I do want to add just a few slides on the update of influenza status. We are starting to see more positive tests, but still percent positives are quite low. For the week ending December 25th, about 3% of the influenza tests were positive. And next slide. And as of December 25th, about 12 hospitalizations, 2 ICU admissions, and then we've had one death. And then have the vaccination outreach updates. Again, we still have many sites for vaccine. These are vaccination sites, so you can see the community efforts, we are still multiple sites scheduled for the upcoming weeks. So again, we have not, really pulled back on our vaccination efforts, and we encourage vaccination and boosters, and absolutely agree with you, Commissioner Price, that this is one of the keys for us moving into the future. I just want to touch on some of the, over the last week, 2 weeks, CDC did update some of the isolation and quarantine recommendations for the general population. It's caused some confusion, but, just to emphasize, quarantine is when you've been exposed to the virus or might have been exposed to the virus, but not yet confirmed infection. And so to prevent spread of that infection, you quarantine someone. Isolation is when someone actually tests positive for the virus and is sick, and so they're infected with the virus, and you isolate them so they don't spread it to others. So there's sometimes confusion about those two differences. Next slide. And so these are just a summary.
Stop.
Yes.
That's part of the confusion again on quarantine versus isolation and time. And so if you quarantine and you've been exposed to the virus, then what is the time factor that is recommended for quarantine?
So that's where this slide shows the updated guidance.
Yeah.
And so it's been updated also even, for those that are boosted, and that's the second part of the slide, the bottom part. So the new CDC guidance, if you were exposed to someone with COVID and need quarantine, so on the left you can see if you've been boosted or you've completed the primary series of Pfizer Moderna vaccine within the last 6 months, or you completed the primary series of J&J within the last 2 months. The recommendation then is you wear a mask around others, and this is vigilant masking for 10 days, and test on day 5 if possible. If you do, you monitor for symptoms. If you do develop symptoms, get a test and stay home, because then you might need isolation. And this is for the, I want to emphasize also, this is just for the general population. For other settings that are at higher risk, there are separate updated guidance for healthcare settings, also school settings, congregate settings like homeless shelters, those things that, we are a little more specific guidance, but this is for the general population. And then again, for the isolation, they're saying everyone can stay home for 5 days, and then if they have no symptoms or the symptoms are resolving after 5 days, can leave the house but continue to wear the mask around others for 5 additional days. If you can't comply with the leaving of the mask, then you should isolate for the full 10 days. And again, the last slide, just a little more detail on the guidance. If if you've completed the primary series, but it was over 6 months ago, or completed J&J over 2 months ago, and aren't boosted or unvaccinated, stay home for 5 days and continue to wear a mask for an additional 5 days. So now I think Mr. Wilson is on the line, and we're going to talk about some of the employee safety issues.
Good morning, Judge and Commissioners. This is Bob Wilson, and for the record, Human Resources Director, Dallas County. And what I was asked to do is provide an update on basically how we, as a organization, are implementing the guidance that CDC and HHS advise us to follow. So basically, since the last 2 years, we worked closely with IT, Health and Human Services, facilities, Homeland Security emergency response to then craft guidance for our employees and get those statements out. Just lost the presentation. All right, so to finish that slide, the Omicron variant, as Dr. Wong talked about, is spreading very quickly. And I want to thank, we've been communicating all these changes that have come up regarding isolation and quarantine, testing, and I just want to thank the directors and the elected officials for great suggestions and contributions to enhance our employee safety. So let's talk really quickly about the tools we have. We've communicated through a two-pronged approach through the directors and the elected officials and to the employees at large. Number one, vaccine is the best public health measure to protect people from severe illness and hospitalization, highly effective at preventing severe illness, and we recommend, or CDC recommends that everyone 5 years and older protect themselves, communicated that for friends and family at home, and then there's a link to the locations that CDC says we can get vaccines. Next slide, please. So the biggest change that we've had and communicated is that KN95s and 3-ply surgical masks are now required at Dallas County. If you choose to wear a cloth mask, it's not recommended alone, but wear it over the other masks. And so we're hitting this really hard in our communications. Next slide, please. So we've talked a lot about testing, and what's important is what they do is they let you know if you're currently infected. What I will say is we've seen an exponential increase in the number of claims that we're having here at the county, and in testing, timely testing still remains a challenge. And so the symptom-based approach that Dr. Wong just talked about regarding isolating 5 days and then can leave the house if symptoms diminish, that's really an opportunity that we have when testing isn't available. And we've also ordered self-tests for the county. Obviously, this group is aware of those, and we're working on the protocol to get those sent out to the departments. And so finally, we've talked a lot about personal responsibility. If you're sick, stay home and be aware that you can spread COVID even without having symptoms. Next slide, please. So one of the last communications that we put out were the new testing locations, new and existing, so that employees know where they can go. Next slide, please. So finally, the update. Here's what we've accomplished since we last talked to you about the reopening, really. So at the current time, all non-essential travel is still being denied. We've encouraged department heads and elected officials to implement telecommute as practical, and they have all been great with that. The other thing that's helping tamp down the spread is we're doing A/B schedules, or we're doing, part of the group or part of the team on-site, part of the team telework. We've encouraged that not have face-to-face meetings currently and go back to MS Teams as our primary means of collaboration. So some detail on what facilities has done is they've done great work within our buildings to increase airflow and air exchange, added better MERV filtration. They've placed electrostatic filtration system in our detention facilities, UV lighting in the ductwork, addition of bipolar ionization units, and we've got HEPA fans that we purchased for use in the juvenile center. So kudos to facilities for implementing that. Janitorial services, we've got a program in place where departments can order PPE, and currently we have plenty of stock of KN95s and surgical masks that each department can order and get those to your people, help keep them safe. Got hand sanitizer throughout. We've got disinfectant that we're now handling internally. If you have an area that needs to be disinfected, please, you can use that same program to order that, the disinfecting from facilities. And then we have day porters that continue to disinfect high-touch areas at least 3 times a day. And then fleet operations, Mr. Hooper and his team are doing everything that they can, including germ blasts, to make sure that our vehicles are sanitized. They have a very good response. Basically, the vehicles are ready 24 hours after disinfection, and they're protected for up to 90 days. And so that was important to me, that you all knew what steps we've taken to keep the employees safe. We'll continue to communicate as changes occur, and appreciate all the cooperation again from the departments and Dr. Wong's guidance. And that's the end of my presentation.
Mr. Wilson,
Sir.
what percentage of our employees are vaccinated versus not vaccinated?
So what I can tell you from what the information I get from UHC is they indicate that we've got just about 2,000 employees vaccinated.
Well, we have 6,500.
Yes, sir, you are correct. Now, what I will tell you is I'm back. My I've got a status, and it's is not, I don't know what the disconnect is, but not all the employees' vaccination status is being updated through UHC. And so that's where I've got to do some more digging to figure out how we can find out where at the mass immunization sites we get credit for those employees being vaccinated.
But
that's right.
my concern is, okay, so we got 6,500, we got 2,000 vaccinated. Where are we on weekly tests? And I know we've got these new test kits, but you know, I'll go to juvenile. You know, those kids are in our care, custody, and control. They're isolated, and they're not getting any visitations in person. They're virtual. But then we get it in the population, so that means somebody's bringing it in. And I guess I've got a real concern. Now, like I said, if you look at my staff, we're 100%. That's road and bridge. That's downtown. We're 100%. I don't understand how we can continue to talk to the public about getting people vaccinated, and then our people aren't, or we don't have a rigorous testing every week for those employees. And I know what the DA and everybody else has said. I just don't understand it. I don't understand it. Basically, we got a third of our employees who are vaccinated.
Right. I agree with you, Commissioner, and I know that the governor and I know Mr. Roden reminds us all the time that we cannot ask, but it's going to be hard to beat this pandemic when we don't have our own people vaccinated.
We have a responsibility, and I told my people, I've got people at home who's married, who have people who are compromised, who've had breast cancer, who's had all kinds of comorbidities. And then I'm allowing you to work side by side, and then,
I agree. We'll agree with you on that.
Here would be my suggestion on this. If HIPAA says you can't ask something, then we don't want to ask that. If it's the Attorney General and the Governor who are being sued by a bunch of school districts, me, a bunch of folks, because they are trying to stop local response to a virus. They're trying to tell businesses you can't have a vaccine requirement in your business, even if it's a small business and you are a highly immune compromised person. Small businesses aren't paying any attention to that. So we need to protect our employees. If the federal law allows, and the laws that the legislature passed, not just the governor's, fiat because he thinks he's the commander in chief, but if the laws on the books allow us to ask, we should ask. If the laws on the books allow us to protect our employees, we should protect them. I'm not worried about the governor suing me over whether or not I get my employee who's staying home saying they're sick to take a COVID test.
There you go.
So that we can actually see that they have COVID and help them know when they're negative.
And we will discuss this today as another item.
If we sit around and try to do whatever the governor says based on the last poll he saw, then nobody's going to be protected. So we need to do what the federal law and common sense tells us to do.
Well, again, I owe it to my employees and their families to provide them the best work environment and safety that I can. And again, I'm not, Mr. Wilson, I'm making a comment that 6,500 employees and a third of them vaccinated. I just I don't understand.
So can we get some clarification then and some direction so that Mr. Wilson can move forward? Are we looking at a mandated policy, or do you want us to revisit the test/vaccination policy that we were talking about earlier, where you either show you're vaccinated or you get tested every other day or every week or wherever we want to develop it? But are you giving us direction to look at one of those options?
Yeah, look at the one that you think would work the best and get back to us, please.
Wait, repeat that, I'm sorry, I didn't hear you.
I think we should have HR and the administrator's office and HHS and the departments that we've hired to look at this, look at it and tell us what is the most effective way to protect our employees under current federal and codified state law, not fiats from the governor, but the actual law, and then bring it back to us with your recommendation.
Okay.
And I think we have an item today on agenda item number 39.
Yeah, and
that
if
some
you-
of these issues are going to come up, Mr. Martin, because, I mean, and I don't want to talk about it until we discuss it, but it's exactly what we're talking about. I mean, how we're going to protect them. I mean, if we see in this last part of the presentation, telecommute, travel, rotating schedules, and then again, we don't even know, and we're not even asking if they have a positive or a negative test.
Right.
That makes absolutely no sense.
So we can actually handle this fairly quickly if you want to suspend the agenda, and let's bring that forward, because my recommendation is that we not move that item forward until we come back with a policy. And we could do that fairly quickly. And if I have to call an emergency meeting, I'll call an emergency meeting. But if you give Mr. Wilson and myself and Dr. Wong.
I move to suspend the agenda and bring agenda item number 39 to the floor.
Second.
All those in favor, signify by saying aye.
Aye. Okay. And now that I can discuss this, you know, this, and I want to thank Mr. Wilson and administration for bringing this forward, but it's so general. It's so ambiguous, and it actually doesn't follow any of the discussion that we have done today. According to this briefing, we will allow our employees to go home and for 6 days, but then again, without any proof of a positive testing and no proof for them to come back. Right. You know, like Dr. Huang just mentioned, you can be positive with absolutely no symptoms, completely asymptomatic, and be more than 6 days contagious. So I don't want this employee to come back until they have a negative test. So like Commissioner Price said, we know the environment is safer. We still will wear the mask, we still will do the distancing, we'll still do everything that is required for safety for all of us, but I think it makes more sense to know that. Now, what the judge just mentioned about we cannot ask, but we can definitely, if you're getting a benefit out of it, right? If I'm going to pay you for 6 days of quarantine or isolation, you know, I do want to know if you're vaccinated or not, because if you, I mean, if and again, I'm trying to be legally correct here. Yeah. You know, it will be, I will not ask, the county will not ask. It will be up to the employee to say, I want to get paid those 6 days, you know, but if you're not vaccinated, I'm sorry, you cannot get. It will be up to the employee to prove, right, Judge? That way we don't ask.
Here would be the problem with that.
If they are vaccinated or not. Or again, like the judge say, and I think he say it in the political correct frame, is based on what we are allowed to do by the federal government, based that policy. Because as it is right now, I cannot support it. It really doesn't give us that comfort that we have a safe environment and we're paying money for it.
That's the reason I say,
Judge. There's no accountability in this policy as it sits right now, and I would definitely like to see something that I can support.
So here's a concern though. I'd be all for if I call in sick, I'm an employee, I call in sick, I say I have COVID. We now have these little tests that we all took. We can make sure that they either have one at their house, or we can take them one, or we can say, come into the Road and Bridge office and we'll hand you one through the window, whatever. we do need to make sure that they're tested, right?
Right.
And continue to test them so we know when it's safe to bring them back. If we were though to say, you made a bad decision, and didn't get vaccinated, and so we're not going to pay you for the 5 or 6 days that you have no symptoms or minor symptoms, but you know you're COVID positive because you got a test after your child came back COVID positive. It's highly likely that those people who did not have that community spirit of wanting to help by getting vaccinated would decide that they need to feed their families, right? And so they would then go to work with COVID. They might even try to mask, or they may not, and everybody in their department would get COVID, and we'd be shut down. So it's not so much that we're helping out unfairly people who were selfish in their decision to not get vaccinated. It's that we're helping out all their coworkers by incenting people who have COVID to stay the heck out of our buildings. That's what we're trying to do.
Right.
I think we're trying to do both, Judge.
Well, there are different ways we could try to incent people to get COVID. We could, if they come back with some sort of a vaccine requirement, or a $500 for those who have been vaccinated and $500 for the people when they get vaccinated, or $200 a shot, $200 for your first, your second if you've already had it, your booster if you've already had it, and that would help us get our 2,000 people who've already had it to get their boosters, something like that.
And it can be one either or. I mean, the main issue, I think that, and I believe that I can speak for all of us after this discussion, is we want to incentivize our workforce to get vaccinated. Because it's the right thing to do for all of us.
Right.
And to keep a healthy work environment. Look at this, in less than 3 weeks, we are separated already again.
All I'm saying is, and again, I'm gonna keep talking about these. At the end of the day, we talk about individual families' bottom line, which we're concerned about. I'm concerned about all of my employees, but I'm also talking about our bottom line. Now, let me just tell you, and I sent an email, I think I sent it out to all of you, with regards to the, this dadgum testing. Some people have erroneously sent out some invoices, and they said something like $831 for testing, and then gave a discount of $500, and still $300 and something. Well, 99% of people are not paying anything for testing. If that's the cost associated with what these individual vendors, whomever, are getting with testing, I still want to know what the cost of vaccinations are. And then I want to look at the offset for us incentivizing people to do this. I know what my staff and some of your staff have done with just $25 gift card. I'm talking about a workforce here. I mean, we've got today, we've closed our South Dallas Government Center tax office. I think Mr. Ames sent out a thing, says he got 50 people out. Okay? And, I mean, what's the cost offset? I know Mr. Wilson, did that now, but what are the bottom line? We are here from a fiduciary responsibility to make decisions that's in the best interest of our workforce and our citizenry. And I still haven't seen those kind of offset costs. We need to do that. That's what we do. So I mean, somebody, let's put pen to paper. This is what it's going to cost us. And I know everybody just seems to spiral when we say, $500. That might be a good cost offset. I just told you, testing from the invoices I've seen say $800 or $300 with some kind of discount.
Right.
Really?
You make good points, and Daryl, we should get with TC Broadnex and others, NACO, whoever League of, U.S. Conference of Mayors, League of Cities, whatever it's called, to see if anybody's incentive has worked. One of the challenges is, like Dallas had an incredibly generous incentive. Unfortunately, it didn't move the ball a whole lot on people getting vaccinated.
But didn't DISD move the ball pretty good with theirs, and theirs was pretty generous.
Yeah.
What works best?
Well, let's check with DISD.
What works best is the mandated incentivized plan. I think what we need to do is come back with a menu for you. I think we need to look at testing, vaccination, incentivizing plan, and also that sick leave policy. Put it all in one policy and bring it back to the court. And I want to do it fairly quickly because this thing is moving fairly quickly. So I probably need to call an emergency meeting as quickly as I get this done and call at least 3 of you back together. I'd like to get all 5 of you together, and if we can set it up sort of like this, 3 of you here, 2 of you remotely, so that we can get this passed. But we need to do it fairly quickly.
Thank you,
So then
Mr. Martin.
we want standards, and then we want the protocol.
Absolutely.
So
Correct.
we will then know what to do, and the employees will know what to do.
And at the end of the day, it's accountability for everybody, which is our job as commissioners. Now, thank you so much, Mr. Martin. So,
Commissioner Koch.
Yeah,
oh, I'm sorry, Commissioner.
some good ideas, some things that are probably going to run into legal problems, but I think the key right now is prioritization. While I absolutely agree, vaccination is going to be the thing that, handles it in the long term, we could potentially vaccinate all our unvaccinated employees today and still face the same crisis, right? Omicron evades vaccination, but not only that, you don't have protection for at least 10 days or more, right? And then, at least regarding alleviating our current pressure, and Dr. Wong, let me know if I'm wrong there, the stress has to be on testing, right? So, we need to be in a place and a posture where we necessarily put everyone that does not have to be in the office, needs to be at home, right? We need to do that. That already has to have been done. And if it hasn't, then it needs to be done today. And then after that, if you need to be in a certain place and you are symptomatic, you need a test. And I think perhaps there would be some benefit in somewhat random testing in departments just to get a flavor for, what is happening. Because, there are a ton of asymptomatic cases. I think everyone can point to an example in their recent lives where someone tested for whatever reason and was very surprised to find that they were positive. So, that basically just trying to find 2 or 3 people within a physical location to test, probably not based on self-selection, because there may be some problems there if we can handle it, and got to run it through legal, of course, but that we're going to need to do things like that for the next 20 days during this part of the crisis. So yes, I agree that long-term vaccination, because we're going to keep seeing this, right? This is not over. It's not over at the end of this year. But right now, the emphasis needs to be on limiting people in our buildings and testing.
Yeah, I agree with what my colleague said there. If anyone can work from home, even if you feel like, and I'm talking to our department heads, you feel like, well, when they work from home, they're only 80% as effective as when they work from here. But here's what we got to keep in mind. If you get COVID spreading through your area, then they're not going to be 80% as effective. They're going to be 0% effective. And so it's a tough deal, and it's a deal that we're having to deal with in private sector. And I know on a private sector, call I was on, after you look at what the options actually are, having people work from home makes a whole lot of sense. In the private sector, one of the things people are looking at doing is people who had a track record of being able to work from home and get their work done, they're all working from home, and people that didn't, they're spread out all over the floor of the warehouse or something. The potting deal is an idea too, of half the people coming on Monday, half coming on Tuesday, and back and forth. But why get half your workforce sick with COVID if they can work from home? I'll tell you, my workforce is all working, from home, except for sometimes the emergency managers are in the office, or Jason and Jenny have come up here to get supplies to do a vaccine clinic. Jason's here with me this morning. Others asked if I needed them to come up. And the answer, did I need them? Yes. Did I want them? No. So, you know, they're all doing their stuff from home.
And another thing we need to look at, particularly in these next 30 days, is I know that, you know, the second floor here and some of the other floors have been already vacated for next door. Well, we should use those spaces as touchdown spaces for some folks.
Absolutely.
I mean, we just have it right now. This is probably, this part of the crisis is 20 days. Spread them out here.
Yeah,
We got it,
yeah,
you know?
yeah, absolutely. And Judge, since the agenda is suspended, you do have the folks from NOMI Health waiting, so you might want to jump to the land use agreement item, which I believe is item 34.
Did we vote this? Or are we pulling it?
So this item gets pulled.
Yeah, this item will be pulled, and I'll come back with an emergency item and call an emergency meeting, Doctor.
Excellent. Just to close this, Dr. Huang, on your page, one before last, before the COVID testing locations, you have self-test. If you self-test and has a positive result, stay home for 10 days. And in the page before that, you say if you got a positive result, CDC recommends 5 days. So you need to change probably that one. Probably is an old one. And last but not least, you did send us the Pcci vaccination analysis, and it was an eye-opener about the areas and the, you know, the zip codes that have not vaccinated. And like we were discussing a while ago, it's amazing to see in the areas that need the most, over 50% are not vaccinated. So I hope that as we discuss some of the items today in the agenda, the new clinics, the pop-ups, the different COVID events, we take a very close look at these areas that we all know, you know, need the most in resources and education and vaccination, and are over 50% not vaccinated. Thank you so much.
That's one thing about our staff. Our staff have gone in the areas, and I've had this conversation with everybody from Dr. Wong to purchasing. You know, some of our staff is going in the areas that others don't want to go. And in times that others wouldn't be caught in. So, you know, I want to applaud our staff. I mean, it's great. I appreciate Walmart, and we all get there, and everything's supposedly okay there, and we come in and we do the, yeah. But when they go into communities that a lot of people, you know, don't want to go into, I want to applaud them.
And I want to applaud Dallas County Health and Human Services, the judge staff, and all our staffs, because really, I mean, like you say, Commissioner, I mean, they have, you know, turned up the sleeves and really been in the forefront with all of us. On the other hand, we also need to be sure, Dr. Huang, that I know, like Commissioner Price says, we really appreciate all our partners. And I know right now there's a shortage of nurses, it's a shortage of employees, there's a shortage of people that want to be in this kind of environment. Let's be honest. So we need to be sure that we, Judge, manage some of these fairs and clinics and events in a different way. I feel bad, you know, for the people that had to wait 4, 5, 6 hours, you know, to get tested or vaccinated. That's not right, shouldn't happen. We should be, you know, and I know I talked to Mr. Romain this morning, and he was indicating that they're going to do some appointment again and try different ways to avoid people for congregating and being waiting in line for a long period of time.
Yeah, the only way that we feel that we can fix it at this point with the high demand is appointmenting like you had early on with vaccinations, so that you can either call an English and Spanish phone line, or you can do it online. And it may be, you know, that you won't be able to get an appointment that day. It may be that you have to wait till the next day at 3 o'clock to get an appointment. But the way that we do that is if the capacity for a test for that hour, or 100 tests, we'll book like 120 people, because some people won't show up. and they'll tinker with that number to make sure they get the right number. And they say, NOMI says, and we're going to get NOMI on the phone here in a minute or on the Zoom.
They're on the line already, Judge. If we can pull item number 34, so we're holding 39, and item 34 is the land use agreement with NOMI Health, and I believe NOMI Health is on the line. If you could pull that item up for discussion.
Good. Okay, yeah, please.
Move to suspend the rules.
The rules are already suspended.
Oh, okay. I mean, I move to pull item number 34.
Well, I'm not going to pull it. I want to discuss it
For
because I've looked at all of the information that they've generated, and
I pull it for discussion, Commissioner.
Oh,
So
okay.
go ahead.
Okay,
The
pull
floor
it
is
for
yours.
discussion. Okay.
The start with NOMI has been, poor and rocky. And so we visited yesterday with county department heads and NOMI about ways to improve that. And both NOMI and the county came to the conclusion that, and I think are in agreement, that the only way we're going to get people in and out in a reasonable amount of time is through appointmenting, where they feel that with appointmenting, they can get people through the line in their hour. So if my appointment's at 2 to 3 and I show up at 2 or 2:10, I'll be out of there by 2:40 or 2:50. And right now, we have a situation where people are waiting in a line for 6 hours. They're running out of gas. They're having to get out of their cars and leave them running so they can go urinate and porta-can because they've been sitting in line so long. Just not at all acceptable.
It's not.
So, and I just want to confirm this with NOMI, and they all can ask NOMI some questions, but I want to make sure my understanding of our conversations yesterday are correct. We moved to an appointment system at 8 o'clock last night. This morning, you have 3 working traffic signs out there. You have 10 contract security. They're actually on the premises doing traffic and whatever else needs to happen. And you'll keep 10 at all times, not aspire to have 10 and end up with 4. But if you have to overstaff, you will have a minimum of 10 security people there during hours of operation. Mr. Frosch, what I'll leave out? Oh, you have already moved porta-cans to both sides of the tent so people don't have to walk across traffic to go to the bathroom.
Well, Judge, again, I was out there every day from the day they stood it up, 4 hours, and every day since then, including Sunday. 2 or 3 things. First of all, it's probably somewhat of Fair Park, but the most accessible site. The problem is we've got an interstate there. We've got truck traffic that is exiting.
Commissioner, hang on 1 second. We want to hear all that, but I listed to you what I understand our agreements were from our call last night. Did I get any of that wrong, Bo, who's a co-founder of NOMI?
Yeah, he says he's muted right now.
Well, unmute and tell us, and then we'll get right back to Commissioner Price. Did I get any of that wrong?
Yes, Jeff. So if I can reiterate, so we talked about 2 digital signs. There are 2 digital signs up since last night. That porta potties were moved this morning to relocate it. Appointments have been in place, and right now the wait is between 0 and 10 minutes. And folks are not allowed onto site if there is no appointment there. As well as the security aspect, yes, we understand that there are 10 at all times. We have 6 currently because the Soto police force only sent 2 because they're having challenges. However, as agreed last night with Chief Santos, Chief Santos was going to work with DeSoto to make sure we close that gap, and we expect that gap to be closed today. But the wait times are so low.
Well, see, but again, see, I've been hearing this. You know, the first day we had 12 constables because, like I said, the traffic. First of all, there's a school adjacent to Ellis Davis. That's number one, and it's a elementary school. Number 2, that traffic in less than a half a mile impedes a interstate, where truck traffic is ingressing, egressing Polk Street. And then, of course, Polk Street goes south across the interstate. And that's what it did the first day. Second day wasn't much better. And so I have not seen a sufficient security plan that will deal with less than 10 individuals, even if you reroute it. That's first and foremost. There's not been sufficient signage. And then number three, I know my road and bridge about cones and all. I have no comfort level that this site is being managed in a way that's safe to the public and in the best interest of our citizens who are accessing that site. And I've watched it now for over a week. We're coming up on a week that I'm just not sure that nobody understands what's really going on there. And Marshal Del Santos has been out there. I called him day one. Constable Gully with 10 of her officers, or 12 of her officers really, was there. Then second day, they were talking about contract security with Marshal De Los Santos, along with Precinct 1. Still, not sufficient signs. Number 4, no heaters on the day when all of the computers froze up. I mean, really? Come on. If they're running sites all over the country, damn it, this is just basic. This is basic. And yes, they had 4 lines. They had 1 registration and 3, testing. I don't know if that's sufficient or not. I hear y'all keep talking about that registration, but we know, just like you talk about overbooking for 125 for 100, we also know individuals are going to show up. There were people in the line the other day looking for vaccinations. And they finally, after waiting for hours, said, well, y'all not going to do vaccination? No, this is testing. And so I don't have a good comfort level that, and I don't want to, y'all may consider it an emergency. I don't want to pull the item. I just want to make sure that, that this site is getting some priority and that we're beginning to see a process flow.
And let me ask.
May I?
Go ahead, sir.
So, sir, can I address some of those concerns? Yep. So at Nomi Health, we do about over 120,000 tests, vaccinations, monoclonal. When the antivirals are available, and we'll be doing that as well as services, lab services. I agree with you. It was a rocky start. We own that 100%. We were also asked to get the site up as quickly as possible, and so there were some things that were missed, and that is 100% on us. We absolutely agree. And the support that the county and you, Commissioner, provided us on that first day, outstanding. So I want to thank you for that. Over the few days where we did not ask the question, because we were under the assumption that we wanted to get as much throughput as possible for testing. Just as a side note, we've done 8,000 tests at that site since Wednesday. After the conversation was brought up specifically last night of the appointment's on. Right now there is 0 wait. I just got a picture from the site. There are 4 bays operating. Everyone has to be registered. There are security at the gate checking to ensure that folks have the QR code and the appointment time at the day, and they're also being directed that vaccines aren't there. So you're absolutely right. We have adjusted. The reason it's taken time to get the signs moved and the porta potties moved is because, just as you have been describing all day today, that COVID has wiped through these vendors, and trying to get people to site to move those things has been a challenge. So we hear you. We take our responsibility quite seriously, and we feel that we've addressed this. And I would say that you can now look at the site today running with 0 to 10-minute wait, and we have appointments in place at this level. They will probably cut the availability of testing by 50%, but we'll ensure that there are not folks in the line for more than 30 minutes today. And I hope that brings you some confidence. I know we have to earn your trust and your confidence and credibility back, and we are dedicated to do that.
So it'll cut the availability of testing today and maybe for the end of the week by 50%. But once you get the word out on appointmenting, don't you think you'll be able to get 100 people an hour, 100 cars an hour tested?
Yes, Judge. So this is what we believe. When I say it's cutting 50%, is that we're doing about 15 to just shy of 2,000 a day with those weights, and those weights are not acceptable. We clearly heard that. So as we're laying out the appointments, the point you made earlier several times, it just means someone might have to come on a Tuesday or Wednesday. So the overall ability to get people testing, if they have a day or two to plan out, absolutely, they will be able to get the test. In that moment, in that day, we're expecting to be about 1,000 tests a day. Right, so that's where I'm getting that cut from 2,000 down to 1,000 a day. But overall, the availability of testing will be available over periods of time.
Okay.
Okay, any other questions for Nomi?
I've, like I said, while I want to take care of our citizens and all, traffic is premier, security is premier, not only for people utilizing the site, but people who are traversing Polk Street. As I said, at 4 o'clock, I know they're going from 8 to 8. Traditionally, they've had to stop and start. I made that observation a couple of times. But at 4 o'clock, people start queuing up almost along that same corridor for school pickup. So now I've got 18-wheelers, I've got school pickup, I've got testing site users. And so I just want to make sure security is premier. And especially going back to that dadgum interstate. Had it not been for Constable Gully, and again, with regards to that truck traffic that ingresses, there's a truck stop right there. So we've got all of the perfect stuff: truck stop, school, site, and a 3-lane divided thoroughfare that carries plenty of traffic. So I just want to make sure that we've got all, and Marshal De Los Santos is going to be, and/or your office, Homeland Security, is in a monitoring position that becomes premier. I want them to have access, but I want that site to be safe. By the way, I think it was Saturday morning when I was leaving. It was Saturday morning. There was right there at the corner, Polk and 20. A pretty horrific accident. Had nothing to do with the site. It was raining and et cetera. So all I'm saying is that is a well-traveled thoroughfare, and I just want to make sure everybody's safe.
So here's what we're doing on that, as Nomi knows. Scott Tarswell with Emergency Management will be making periodic unscheduled visits to check on the status of that place and work with the leaders there, looking to see whether we have 10 security personnel and we have working traffic.
No, you're just talking about Ellis Davis, because it's my understanding. Is this the same company? Do they have the Samuel Grand site too?
No, we do not.
You do not? Okay.
But as to Ellis Davis, because we've had 6-hour waits,
Right.
The employee that formerly was a logistics officer for the military in Afghanistan and Iraq is going to be going out there on a regular basis from my office. I've talked to Chief De Los Santos to talk to Chief Costa about an idea that I think will help. What you may need to do, Nomi, is overschedule. If you continue to have 6 show up for 10, you're probably going to need to overschedule so you don't have to pay people that don't show up. But we need 10 out there. Commissioner Price is right. There's a school right there on that street. There's a ton of truck traffic. 20 is the truck route. it's a mess out there, you know, when I was out there, that has to get better.
But Judge, what I do want Naomi to understand is that we ran that site, or Parkland did at least, for 18 months, and we had no traffic issues. We had, granted, they had 10 lanes, 2 lanes of registration, 10 lanes of servicing, vaccination, flu, testing. They ran 10 lanes, and they ran it with at least about 10 security individuals, but we did not have those issues. And all I'm saying is that Parkland at that time closed down at 4 or 4:30. They're going till 8, and so we got that school that's continuing all the way, well, until they pick up the children.
Commissioner, we hear you. Judge, you're absolutely, that's our plan to overstaff. So we are very much in agreement with that statement. And that is the plan. We look forward to the support. And as we told Field Marshal Santos, we are happy to hire his off-duty folks as well. So we're engaged in that conversation. So we have heard you. We're executing. There's no traffic in those thoroughfares. It's all on site now because of the waits are so low. And we've been maintaining traffic in that site since the weekend, so it hasn't spilt out. But we hear you, we're executing, and I look forward to the observations so that we can ensure that we're living up to the standards you've set.
All right.
Okay.
Good, cool. Judge, can I just say one thing you brought up earlier, and then I will get out of your hair. You talked about the billing. There was concerns around billing. I just want to ensure that everyone knows that this testing is free for everyone that comes. If they have an appointment, we do not turn them away. We do not look for back billing. We do not look for copays. In fact, we send out an email after someone has gotten their result that says that they should not be forced into a copay from their insurance companies or from anyone else. And we charge at Medicaid rates. So we are absolutely setting the bottom of the market when we go. So you should not have any of those concerns coming from the patients we serve.
Yeah, and I didn't mean to infer that was you. I said that because this is the second round that I've had with our people sending those invoices and causing alarm and concern, and I think I shared it with all the members of the court. So no, that was not you, and I appreciate that because I am definitely not trying to send mixed messaging. You know, if you need to be tested, if you need to be vaccinated, up here. So it wasn't you.
All right. So again, thank you everyone, and we're always here to be a resource.
Thank you.
Thank you. All right.
With that kind of oversight, Judge, with the land use agreement, with Marshal De Los Santos in your office doing that oversight, I'll move it.
Second.
All those in favor, signify by saying aye.
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 Any opposed? Motion carries unanimously. Let's go back to our agenda items and knock the rest of this out. Commissioner Price, do you want to have a presentation today?
No. Y'all get spared on the first. You're coming up on Martin Luther King birthday, 40th year that the city of Dallas is going to celebrate. But that's going to be my gift to y'all today.
All right.
Thank you, Commissioner.
This brings up consent agenda. Do we want to separate out?
Personnel, sheriff, and juvenile.
Okay. Is there a motion on sheriff?
On the consent.
Consent. I'll move the consent agenda.
And I second.
All those in favor signify by saying aye.
Aye.
Motion carries unanimously. Is there a motion on sheriff's consent or sheriff's personnel?
On personnel.
Second.
Motion by Cott, second by Price. Any discussion?
We continue to work on, hire a workforce that looks more like Dallas County and shows the diversity of Dallas County.
And I will be abstaining.
All right. All those in favor signify by saying aye.
Aye.
Any opposed?
No.
And all abstain as well. It's 2 abstentions from Dr. Daniel and I. Motion carries 2-1. Next we have
Ward.
Yeah, award of bids.
So moved.
Second.
All those in favor, signify by saying aye.
Aye.
Opposed, motion carries unanimously. There are no RFPs on the agenda. Okay, we now will consider court orders M1 through 33, addendums 34 through 39, pulling 35 off the agenda by staff and pulling 37 for a separate vote. Is there a
No,
motion?
37, we already discussed, it's been pulled by staff.
Right,
Oh,
37?
no, I'm sorry, 39.
No, we voted on 34.
34 and 39,
37, I believe, is Hurd's contract and Commissioner.
I
Koch
pulled
Correct.
that for separate vote.
pulled it for
no,
Right.
that's Commissioner Koch.
Right.
So, is there a motion on those?
I'll move, I'll move with the exception of those, pulled, except on 26, the proposal to, rename, Windmill Hill, to Paul.
Commissioner, don't we have to second, and then?
Yes, okay, go ahead.
I second Commissioner Price.
And the reason I was doing that, the only thing I wanted to do, in the renaming, is to say, Paul S. Dreyer Act. The signs, that's a signage issue, and, on 26,
We need to pull 26 because we have a speaker.
speakers, yeah, we got speakers, but they're all in the affirmative, but okay. Go
Pull
ahead.
it for.
I'll pull it.
Separate, okay. All right, and we,
So I guess the seconder accepts the amendment,
yeah. Who is the seconder again?
Dr. Garcia.
Yeah,
Except the full?
yes, of
Okay,
course.
so I'm gonna read those so everybody will know, and by everybody, I mean the two men at the end of the table. The motion is on all the court orders pulling 26, 35, and 37.
Right.
Those are gonna be pulled for separate votes. All right, all those, any discussion on these before we vote? All those in favor, signify by saying aye.
I just have a few comments before we pass the agenda. There is, I know we're gonna discuss 26. Hold on, Judge. On item number 36, I asked a few questions about the encasements of the televisions at the jail. I understand there were some issues with the vendor, and that's why this is happening. Mr. Martin, agenda item number 36, I know that Dr. Watkins did respond to some of my questions about some of the plugs needs to be covered because of
Yeah,
contraband activities.
there's been a lot of damage to those by some of the inmates, and so we have to encase those. So that's what this item is for, so that we can protect those. We have to provide TV
With a new
service.
vendor,
Yes.
with the same amount, for the same price?
Yes, I believe the price was the same based on the information that she sent you last evening.
Okay, sounds good. And then for the additional personnel PPA agenda item number 6, with COVID related rescue plan, I would like to be sure that every single item, has some of the bilingual personnel that we need to do some of these functions. I think that you already know that.
Absolutely. Yes, ma'am.
And then we have the garage of the North Dallas Government Center, Commissioner Koch, so it's included, and that is done. We also have the South Oakley Dallas Farmers Market. I think this is a great project. Obviously, I just wanted to tell Dr. Huang that I would like to see some of the vendors to be from these areas that PCCI identifies as some of the most needed.
I've asked Dr. Wu. I asked him for a full briefing and specificities, and I'm sure all the court wants it, but I did talk to him and Mr. Shovelmeyer, this morning. So I agree with you, Doctor.
Well, I look forward to hear that briefing as well. I mean, it will be, I think that, I know that they're about to go for proposals and for different vendors. So I would like to have a goal of the people and the families that are going to be helped, so we can have accountability on the project and on the funds. And I think agenda item number 39 we already discussed, so that's it with me. You can call the question, Judge.
All those in favor,
I have one quick question. On number 19, point of clarification, is that 10 dash house vouchers that are being described here?
What's that? Oh, number
It's
one.
number 19, it's the HUD Veterans Affairs Supportive Housing,
Yeah, those are 10 vouchers.
10 vouchers?
Yeah,
Yeah.
that's all.
Thanks.
All right, all those in favor, signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Next, we'll take up those that are separately called. The first one is 26. We have a speaker on 26. If the bailiff will please read the rules of decorum.
When you move it, second.
I moved 26, and as I said, with the, at the reserve to be included. That's,
And I second.
Right?
Second.
All right, I think Dr. Garcia may have beat Dr. Daniel for the second on that one, whatever you want to put down. Go ahead, sir.
All Commissioner Court attendees are hereby advised that this meeting is conducted in accordance with the provisions of the Dallas County Code, Section 74-71. Visitors and registered speakers are to preserve order and decorum at all times. Personal, profane, or slanderous remarks are not appropriate and will not be allowed at any time during this public meeting. Any and all applause is to be kept brief in observance of time constraints. Disruptive visitors and registered speakers may be removed and are subject to the penalties provided in the State of Texas Penal Code, Sections 38.13, 42.01, and 42.05. Registered individual speakers are limited to a maximum of 3 minutes, and the maximum discussion on any one topic is limited to 30 minutes. Thank you.
And our speaker on this matter is the Honorable Candace Quarles. Councilwoman Quarles, Councilwoman Quarles. We see her online there? Let's see, okay. All right, hearing that our speaker's not here, if there's nothing else, let's take a vote. All those in favor, signify by saying aye.
Aye.
Any opposed? The motion carries unanimously. Our next matter for vote is, make sure I'm right here, Darrell, looks like it's 37, right?
37 is before.
Right, because you want to.
Judge, you had one other speaker on that item,
Oh, do we? I beg
K.
your-
Brown Patrick.
I beg your pardon.
He's got to call the name. He's got to.
Our next speaker on 26 is K. Brown Patrick. K. Brown Patrick, K. Brown Patrick. Does anybody see her online? Here and left, okay. All right.
So 37 is,
37. Is there a motion on 37?
Judge, I move Court Order 37.
I think Dr. Daniel did a minute.
Oh, she did. I'll second. I'm sorry. I apologize. Second.
All right, any discussion on this before we,
I was hoping Mr. Scarpello can just kind of give us some color on why we're doing this. And my concern is this, is that Mr. Hurd absolutely has great institutional knowledge, but the last time he worked for Dallas County, he quit right before the primary in
no,
2020.
that's incorrect.
What's
That's
that?
incorrect, he was fired.
I'm sorry, what was
Never
that?
mind, but he did not quit.
He didn't quit.
Maybe I can't say anything about that.
Well,
Sure, I can say about that.
however, when he wasn't with us days before the primary, and I don't know if this is such a hot idea.
By no fault of his own.
Okay. So I understand your concern, Commissioner, and and Mr. Hurd does have a wealth of knowledge as far as institutionally, as far as what occurred in the 2020 presidential election cycle. And that is one of the reasons that we would like to have him back, because as part of this forensic audit, there's very few people that have that institutional knowledge. In addition to that, we just have a tremendous amount of work to do to dig up lots and lots of records. And so he has that experience and knowledge where he can really assist with that, not only for the audit, but for a lot of public record requests that we're getting for that 2020 election right now, as well as several lawsuits related to current lawsuits that we're in regarding SB 1, SB 1111, et cetera. And so we really think that he could be very valuable.
All right, so, I mean, you're vouching for him. You're saying that this is going to be a good thing and he's going to help your office
Yes,
perform.
and we're going to have him very narrowly focused on those things. He's not going to be part of the management team for our current elections.
Okay.
I do have to bring up one thing, and I apologize. It looks like we have a typo. In section, it's a rate of $55 per hour rather than $54 per hour. There was a little bit of a conflict on that within the contract, so I think we might want to modify that on page 2 of his contract.
So the maker accepts that amendment, Dr. Daniel?
Dr. Daniel?
Yes, yes.
Seconder accepts.
All right, any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed?
Aye.
Motion carries unanimously. Okay, this concludes our court orders. We do have some public speakers. Let's go through those quickly. Hang on a second. Yeah. Okay. Let's go through those quickly. Our first public speaker is Ms. Dolores Phillips. Is Dolores Phillips on the line? Okay. All right, Dolores, I'm going to go to the next person and come back to you. If you can hear, I hope you can hear me. We're going to get to you when you're able to speak. Our next person is Harriet Nicholson. Miss Harriet Nicholson. Miss Harriet Nicholson. You see her? Okay.
Hello?
Dolores? Go ahead, Dolores.
This is Dolores Phillips. Can you hear me, Honorable Jenkins?
Yes, I can hear you, Dolores.
Okay,
Happy
can you
New Year.
pull up the presentation? They told me you were going to pull up the presentation. It's a 53-page presentation, Honorable Jenkins, and it wasn't supposed to be on my 3 minutes.
Your 3 minutes hasn't started yet, Dolores. You're in good shape.
Okay, so can you see the presentation? It says, when I click on share, it says this meeting type requires that you become the presenter before sharing content. I guess that has to come from your end to allow me to do the presentation. I guess you have to activate it from your IT. Your IT has to activate it.
Dolores, it's pulled up. You can go ahead and speak to it.
Okay, is it the 53-page presentation?
Yes, ma'am.
Okay, Delores Phillips, you know the address. Honorable Jenkins, I sent you and Marcella Moore emails. I'm asking you and Marcella Moore, Honorable Moore, and yourself to do an investigation into what happened to my 12 CDs, which were exhibits and filed in the court as exhibits. I'm not saying anything about the court. I believe it's bigger than the court. As you see, if you look on page 2 and 3 of this document, of using the pages in the right-hand corner, this is the FBI CD with files. The original files come from this CD. You have the Dallas Police Department records from the altered 911 call back in 2009. If you go further down, 9, 10, and 11, in the right-hand corner, those pages, you will see Dallas Police Department CD that was given to me, and I filed it with the court exactly as it was given to me of the 2011 investigation where Lee Polk saw the calls that they said was never made. I want to say this, and I say it in humility. In the glorious honor of truth, I do not do open, and I do not fight police. I have spoken with 3 police separate of the other in different years who said that the police report had to be intentional, the way that you have to generate the report via the computer. Also, this last year, January 25th, 2021, Dallas is yet to release the unredacted body cam and dash cam of what I allege to be a retaliatory traffic stop, and the officer exploited, just like Herbert Cotner was exploited in Green Oaks, premeditated Green Oaks. This officer said, I was going to give you 1 ticket. She put emphasis on it. It's amazing to me how my beautiful sisters beyond race and beyond sexuality can sexually harass, perversely harass, commit sexual misconduct to get open. On the flip side of the coin, tell Me Too stories and get people fired for less. Now, I'm on the hot seat. I'm a woman with a Me Too story. I wouldn't call it a Me Too story, but I'm a woman. I'm a grandmother. I'm a mother. I love my beautiful sisters born with vaginas, but the truth, let the truth be the truth. I'm going to stay on the hot seat because you have a fabricated police report connected to my name. You just got me last year of a retaliatory traffic stop. You will not release the full video. Honorable Jenkins, you're a lawyer, you're a judge, and I have the utmost respect for you. When people come into court and show a righteous anger, people want to say that they disrespect the court. I've seen yourself and others in that court angry, right? And I believe you had a righteous anger. Honorable Jenkins, there's no doubt in my mind that you, Dr. Garcia, Dr. Daniel, if you had a fabricated police report against your name, it would be hell on this earth. But that's fine because it just takes no convenient or conventional way for a minority to get due process, but it requires perfect impartiality for due justice. This involves joint and several liability. I'm sorry?
Yeah, your 3 minutes is up, Dolores. Thank you.
Okay, can you do an investigation for me, Honorable Jenkins? Because it's a process for getting exhibits from the court. You just can't get exhibits from the court and not go through the process and give your name and then get permission before you take these exhibits. I want my exhibits. Can I get them, please? I need to prepare documents with those exhibits.
Dolores, you're out of time. I'll check with our legal department and see, but I don't think any of us have the purview to get involved in another jurisdiction's matter, but we'll check.
But Honorable Jenkins, all due respect to you.
Time is up.
I'm sorry, Dolores, your time's up here. See you next time. All right, our next speaker is Bianca Davis. Oh, I'm sorry, no, I beg your pardon. Bianca spoke at the resolution, of course. That's it, yeah. Okay, that's it. We're gonna do closed session from in here, spread out. If you don't need to be here for a closed session, please go outside. We'll start closed session in a couple of minutes. Oh, and I gotta say this, I forgot. We're gonna consider matters under Chapter 551 of the Government Code as previously posted. Any action as a result of a closed session will take place in a subsequent open session.
schedule.
All right. We're just closing, right?
Yeah, it's just, you don't even have to stay for all of them, just gonna say it's adjourned. Oh. Say it? All right, no action as necessary from the closed session. The court stands adjourned. Thank you all.
Thank you very much.
All right. Hey, Gordon.